Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each week, we deliver informative health and wellness topics you want to know about, so be sure to subscribe to us on your favorite podcast channel. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session, streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPACares. Now, here's your host, Chief Operating Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm your host, Kyle Longton, and with me is...
Maddie Norton.
Maddie, open season is over. In fact, it ended in early December. More than a month ago now. But we've had some tremendous results from open season. More than 2,000 new enrollees have joined the Foreign Service Benefit Plan. And a lot of them were in the family enrollment category. So we're seeing probably close to 5,000 or more new members.
This is great news. Very excited. Thanks for joining us.
Absolutely. Hopefully some new listeners coming our way.
Yes.
And listening for the first time. I do just want to say, that is more than double what we saw in the previous open season. This is really a record for us. And I just want to let our listeners and others know that, this does put a strain on us a little bit more than we expected, but we are working diligently to keep our promises to you all in terms of answering your questions, getting information to you, answering the phones, answering the emails, and so forth. So we appreciate your patience. We've got some new folks in training to join our colleagues who are answering those calls now. They'll be joining the ranks very soon. But we look forward to continuing to serve our longtime members and serve new members. And in the FSBP area, that means more than 100,000 lives covered all over the globe.
Wow, that's incredible.
So I also want to mention that we continue to bring you some new opportunities to learn and to ask questions. This podcast is a new way to learn, but we continue to offer AFSPA Live. And Maddie, I think we have one coming. We've just had one, actually. By the time this podcast comes out, we will just have had one. I wonder if you could tell people a little bit more about that.
Yeah, so the AFSPA Live that we had just had will all be about 2024 new benefits and enhancements in the FSBP program. So, you have any questions, or we will hopefully have answered all of your questions about the new benefits. And we also have a recent podcast episode with one of those new benefits, Maven. And Maven will also be joining us for our next AFSPA Live in February to discuss a little bit more about their program and to go in depth with it. So if you are wanting to learn more, definitely check out that past podcast, that past AFSPA Live, which will be on our YouTube at AFSPACares. And definitely tune into the next AFSPA Live on February 29th, I believe. I believe it's on the
Leap Day.
Yeah, Leap Day. Very exciting.
Right. Well, and we always welcome suggestions for future topics, both for AFSPA Live and for these podcasts. We've got some plans for for February and March, which I want to make sure we've got everything in place before we necessarily announce those. So stay tuned. But right now, it's January. I don't think we can still say Happy New Year in emails. I think we're past that, as this will be coming out as January 29th. We're actually recording this the week before. But I think we can still talk about New Year's resolutions, since it's something that we try to make at the beginning of the year and keep. Do you have any that you are comfortable discussing here? Anything you want to share?
Yeah, some non-related health ones. I wanted to become an AMC A-list member to go see movies 3 times a week. Yes, I know. So very excited about that, trying to get more into reading and stuff. And then, health-wise, I am definitely trying to get up and moving more. Want to take lots more walks around my neighborhood, and especially just because living in DC is a privilege in my eyes. So I'm very excited to experience the cold weather. I love snow. So it's been nice to kind of walk around and do things like that. But definitely drinking more water too. I feel like people talk about it and it's always like, exactly, Kyle's drinking his water. But I got a new water bottle that I'm very excited to incorporate into my day-to-day routine. So
is it one of those gallon size ones that people sometimes have around our office?
No, I can't. also like taking the metro with that. I feel like it's
Yeah.
just, I can't be that person,
All right.
but more power to the people that do it.
Yeah.
I
Well,
just,
and I appreciate also that you've got goals to watch more movies and
yeah,
read more books.
yes,
So you can walk to the library and walk to the
exactly.
bookstore. You've got it all
hmm
together. All right,
hmm
good.
Yeah. What about you?
Well, you know, one of my main ones, um I went through, I had a family member, my mom actually, who went through some health crises at the end of
hmm
last year, and it was sort of a big wake-up call for me because health-wise, I seem to be following in her footsteps more than I would like. And so it was a
hmm
real wake-up call for me to make sure that I am having my checking my blood sugar as
Yep.
a diabetic, stay on top of that, getting my 10,000 steps a day, which works for me. I've talked with my doctor a bit about that. Drinking water, not just to keep my throat clear for podcast recordings,
Yeah.
but those sorts of things. And also, you know, also making sure that I am keeping up to date with my appointments with my doctor and my specialist, including that annual physical.
Absolutely.
Um, so I have another question for you, and this, I promise this is going somewhere to both you and to our listeners. So it's not just a non sequitur, but you know, speaking of, since I did, speaking of healthcare appointments, have you ever had a virtual appointment with one of your healthcare providers?
I have. Before I used to live in South Carolina and I went to school in North Carolina. But I loved my primary care physician, and it was a 3-hour drive back home. And so for times that couldn't make that drive or whatever, I would schedule an appointment with her, and it made life so much easier.
Okay.
So definitely love a virtual like healthcare provider in that way.
Yeah.
Very helpful, and it also just is great for today's time with like remote work and being in office and things like that. It makes things a lot easier.
Yeah, absolutely. And being able to, in my experience, being able to find a specialist who is willing
Yes,
to have ongoing relationship with me, see me once a year, and then virtual appointments for follow-up. That's something I've
absolutely.
done. Mental health counseling I've done virtually in
Yes.
the past. A lot of our members seem to like that. So,
Mhm.
but you're probably wondering how this all connects. Well, for those of us who have health related um, resolutions, you know, getting that baseline check, finding out what your vital statistics are, where you need to go for the year, is a great way to start with keeping that resolution, any of the resolutions related to healthcare, and doing that through a primary care visit. Well, now you can do your primary care visits virtually. This is a new program that we're offering, and I'm really excited about it.
And I think something that's really important, we'll talk about a little bit more too later in the podcast, is we have Lisa DeLarso, obviously from Teladoc, joining us to talk about it. And um, going to the doctor can be very expensive. And I think that the Foreign Service Benefit Plan really makes an effort to make sure that you're not spending money out of pocket. And that's definitely what this program does, and kind of takes the weight off of you, especially if you're nervous to find out all of those things. And especially if you haven't been to the doctor in a while, it can be scary to
Yeah,
go to a primary care physician and, get your blood work done, get all the statistics and everything. And then it kind of leaves you feeling like, well, what do I do? And I can't wait to dive into this topic and learn all about the amazing things that Teladoc is bringing us.
absolutely. So today, AFSPA Talks virtual primary care. And Maddie, as you said, we're having that conversation with Lisa DeLarso. She is a seasoned executive with over 25 years of experience within the healthcare industry. Prior to joining Teladoc, she has held various positions in the industry, including in this areas of behavioral health carve-out, public sector health plans, population health management, and weight management carve-out programs. She is a senior health plan manager at Teladoc, and where she's been employed for the last 8 years. And for FSBP, she's our day-to-day contact for all things Teladoc in the US. And today she's talking to us about virtual primary care. So without any further ado, Lisa DeLarso. Lisa, welcome to AFSPA Talks.
Thank you. Thank you so much for having me today. I'm very excited to participate and help share a little bit about the products that are in place through Teladoc. And I'm particularly excited to provide an overview of virtual primary care.
Me too. And so I just want to note for longtime listeners and those who also participate in AFSPA Live, you may recognize Lisa. She was previously joined us for an AFSPA Live event, but I think this is her first time on our podcast. And Now, our listeners should be familiar with the virtual solutions that we offer in partnership with Teladoc, beginning with the chronic care solutions that are part of what are known as the Livongo suite of solutions. But we also have general medicine, dermatology, nutrition, and mental health support that members can access through Teladoc in the US. But today we're talking about something new, and that is, as Lisa, you mentioned, the virtual primary care, which we'll refer to as either virtual primary care or primary 360 or P360. And we'll come back to that. But I'm hoping you can help us distinguish between the virtual primary care that we're talking about today, and talk about first of all, what it is not. It's different from the general medicine care that people may have used before. So just to start, can you give a brief description of the general medicine before we dive into primary care?
Sure. So general medicine, as some of you may know, is offered 24/7, 365, and that is in place for urgent care. This is basically an opportunity to give members access to low-cost, high-quality virtual care for a broad range of everyday healthcare acute issues, cold and flu to rash and sunburn. This allows people to have access to board-certified physicians anytime, anywhere, so they can avoid unnecessary trips to the doctor office and costly visits to the emergency room. We basically bring care to the member where they are. We meet the member at their time of need.
Love that, meeting the members where they are. And so that program is still available when people need it, but today we're focused on primary care. So now typically when I think of primary care, I think of my annual preventive exam or my annual physical, whichever term people prefer. And I appreciate having that relationship with my doctor. It's really benefited me in recent years in particular. But when I want to have that annual exam, I usually need to schedule weeks or in the past months in advance. In fact, I checked as we were preparing for the podcast, and it was 3 weeks, which was a short time. But that appointment is usually for no more than half an hour. And if we have, I'll have lab results ordered during that, and there's follow-up, and that's usually a fairly brief appointment if there's an appointment at all to go over those. So, Lisa, when we're talking about virtual primary care, what are we talking about?
Sure. So our solution is a solution that inspires a long-lasting relationship between members and care providers through longitudinal care plans, continuous care team support, and a unified whole person experience. And what does that break down to? Basically, it's a solution that isn't always available with traditional brick and mortar care. Our solution is personalized, flexible, there's choice to the providers, it's convenient, and we have a very, very robust care coordination. This begins essentially with the new patient visit to every checkup afterward. Primary 360 allows people to be fully supported by a robust care team across all their healthcare needs. And we do this through care plans and unlimited access to the team, supported by navigation to the services that they need to drive members to the right care. We basically have this optimized to act as a hub for Teladoc's broader suite of services. And as you said, Kyle, earlier, supporting mental health, dermatology, expert medical services, chronic care. And as an added value, it's a point of referral and coordination with the Aetna care management team and other in-network Aetna providers. And what does this all mean? The result is better access to convenient, tailored healthcare that drives members high member satisfaction with better outcomes and lower overall costs, essentially.
So Lisa, we won't wrap up here, but I feel like that's a great description. I want to get more into it, but I have to start with a confession right now that I've wanted to offer this program to Foreign Service Benefit Plan members for almost 2 years, since I first heard about it at Teladoc Forum in 2022, it must have been. So I am delighted that it is in place for members to access. And I want to walk through the whole experience. You've given us a great overview, but I want to go a little deeper into the whole experience. So where do members start? Where do they go to schedule their first virtual primary care appointment?
Sure. So we make this super simple. A new Teladoc member would download the Teladoc mobile app, or they can go right on the desktop version and download it, log on through the Teladoc website. They'll then register to use our services through a simple interface. If a member has already used our services, they do not need to re-download and they do not need to re-register. They'll see a tile and they'll be able to click on that tile to access care. Eligible members will be basically offered right away the opportunity to activate the Primary 360 service, begin to select their primary care provider, and they'll be able to start the process, right on their way. I also will add, if a member is on the Aetna Health app or the health portal within Aetna, they can also access Teladoc 360 right from there as well.
Okay, and I want to go back to something you mentioned, which is that members can select their primary care physician. So you're saying that members are not randomly assigned to a provider?
Correct. So basically, after they, excuse me, activate the service, members will choose the provider. We have a widget and a tool, basically an intake survey that will guide the member through the selection choice based on gender, language, availability, experience caring for members with a specific health concern, a clinical subspecialty, and more. Members will then be afforded the opportunity to see biographies of the physicians who'll match those factors, and then they'll team up basically with the provider in their home state. That's the most important call out there. That member will have a provider in the state that they reside within. Members will then select the physician that best suits their needs and begin to fill out the pre-visit information. And I always like to tell folks, this is just like the clipboard that you get when you go to a traditional brick and mortar setting, but you'll fill that out, that pre-visit information. And then they'll have a new visit and then the flexibility to schedule additional follow-ups and annual checkups with that same provider, unless they deem for some reason that they'd like to choose a different provider at any time.
Okay. All right. And I mentioned this before that, I did a check when I was preparing. My doctor's first appointment for that annual physical was about 3 weeks away, which is great. I've waited 3 months before. So when we're talking about P360, the primary 360, how long are people usually waiting for that initial appointment?
Great. So just if I could just add one comment before I dive in there, the times of availability. The provider visits and patient care team will be available by phone 7 a.m. to 6 p.m. in the local time zone weekdays and 8 a.m. to 12 p.m. on Saturday, and that is exclusive of federal holidays. And again, like we started this conversation, 24/7, 365, a member can reach out regarding, in-app messaging and will receive a response in the next business day. So the care team's there behind the scenes to answer in the in-app messaging. But in terms of timing, we have 3 little buckets, if you will. A new patient trying to schedule an initial annual checkup would be able to schedule within 5 business days. A scheduled follow-up visit with their virtual primary care provider would be in about 10 days. And then if you choose a different provider, it'll be within 5 days also. So between 5 and 10 days, you can see somebody for an initial visit or a follow-up visit. But I can't help but add, again, unlimited messaging to their care team. Somebody's there for you, dedicated phone line with next day response time.
That's great. And I think that's becoming so much more a part of the modern healthcare relationship, is being able to have that ongoing connection, reach out, is this a normal reaction with a new prescription or anything like that? So, one of the questions that people might have, if we're talking about sort of moving the whole primary care experience to a virtual setting, is how can the provider get some of those vital statistics in that virtual setting? You all have addressed that in what happens after the appointment is made. Can you tell a little bit about how the provider and the care team can get things like blood pressure and so forth?
Sure. So again, like the clipboard that you're handed in a traditional brick and mortar setting, we do a pre-visit. And it's a questionnaire where the member will share medical history, health goals, any concerns that are happening right now, information about other clinicians that they visited. We also do a PHQ-9 and a GAD-7 assessment to look and identify any anxiety or depression issues. Each member will receive a blood pressure monitor in the mail, which will be used during the checkup. And prior to that checkup, a member will receive a call from our nurse team to ensure that the monitor is working properly and we're able to pull readings accordingly.
Okay. All right. So they've gone through, they've completed the questionnaires, that paperwork. They've had the call with the nurse to make sure the blood pressure monitor is working, and now the appointment day arrives. So, how much time should the patient set aside for that initial appointment? Is it less than half an hour like I have in person?
No, our initial visits go between 45 and 60 minutes,
Wow.
and it's pretty comprehensive. Our physicians conduct annual checkups and we follow a very rigorous protocol, and that is consistent with several guidelines. The American Academy of Family Physicians, the U.S. Preventative Services Task Force, the American Cancer Society, and the American College of OBGYNs. It's a very deep conversation, for the first checkup. And based on the evaluation, the care team, in conjunction with the physician, will develop a very personalized care plan that will guide the member to any recommendations. So there could be immunizations that are necessary, preventative care screenings, mammogram, pap smears, fecal blood testing, any biometric screenings, cholesterol, blood sugar testing, any additional laboratory tests, and then naturally, if there's a specialty provider referral that's necessary. So it's very comprehensive, and the Teladoc primary care provider can direct the member to a local in-network lab facility or specialist at the member's choice. So we work incredibly collaboratively with the member's network.
And I so appreciate that, because that can be one of the big challenges people face. Sharing a personal story again, over the last year, my primary care provider has recommended I see two different specialists, one for ongoing management of a chronic condition and another for further diagnosis of some abnormal test results. And I spent a couple of hours for each of them, searching my network, calling, scheduling somebody else in case they had an earlier appointment. And some people do not have those follow-up appointments because of the time involved. They spend a little bit of time, they try to make an appointment, and then they give up. Life gets in the way. So I'm just curious, part of the care team support, is there any help scheduling these appointments, or at least prodding members to make sure that they do the follow-up?
Yes, great question. And that's the beauty of the care team. The care team is there to help members schedule these services. The message center will have all the clinical data that's necessary, and they'll help navigate any laboratory testing, any clinical screening, any specialty providers, and all those results will culminate within the in-house messaging. And then the primary care team will be able to see everything in one place and follow up with the results to discuss, after all testing has been complete.
So, and can you talk a little bit about what that follow-up looks like? Is it just a quick message, here are your lab results, or is there a bit more to it than that?
No, it's we basically, again, it's a team. We're going to gather all the information prior to the consult. The lab will, the physician will order the labs to wherever the member so chooses, but then the results are ingested into the Teladoc EMR, and then the provider is alerted and aware that those results are in. They'll then review the results, and then they'll be shared within the message center, and then there'll be notes put into the member's care plan. If there are any abnormal results, the care team or the physician will reach out to the member, depending on the severity, discuss the results, review next steps, any further testing. So it's very sequential. We help, we collaborate, find the laboratory or testing area that's convenient and in network for the member, gather all the information, ingest it in the EMR, and then work as a team to make sure what next steps are.
That's really wonderful. I can remember family members who would get a copy of the lab results in the mail and go, "What does this mean?" And in some cases there were abnormal results and they never got the call from the doctor. They had to try to do follow-up and weren't sure exactly what to ask. So, and I think that goes to one of the other things that you mentioned before, that and I'm hoping you can talk a little bit more about that. This is an ongoing care relationship, that longitudinal relationship that's available. So can you talk a little bit more about that? Because I think that's one of the great features of this program.
So yes, Kyle, super excited. What a longitudinal relationship means is basically our clinicians develop a foundational relationship with members, and it keeps building over time. It doesn't just stop with one instance. It strengthens and changes as the health and needs change of the patient. So for example, a member may follow up with 2 or 3 times before they start doing what was recommended. They, may not really want to, take that drug or start exercising. They're kind of on the fence. They don't know if they trust the advice, but they heard enough about it and they come back. So each visit basically builds that trust and the relationship. And as our physicians, they have to do their part and say that they're listening and hearing, and that my recommendations are different for you than anyone else. So basically, our members are seeing and hearing everything that they're hearing from the provider that's important to them, their family, their friends, their job, all things that come to the table when providers are making recommendations. When members tell you that 99% of this is the equation, it's a big deal. So members need to share in order for them to make the best health recommendations, and they're able to, if they're depressed, they're going to tell you. If they decided to take up smoking, if they feel like drinking. So it's basically, it's going to change as things change in the member's life. It's all about trust and, liking the provider and feeling committed and comfortable.
I think, and that's so important in any relationship with any healthcare provider, that they can't help you if they don't know what's going on. So bringing that honesty, building that trust, goes both ways. And I appreciate that is a foundational piece of this program and building that long-term relationship. So I have missed possibly 2 important pieces, and then I want to ask you if we missed anything else. Number 1, this program is available only to members in the United States. It is not available for members outside the U.S. at this time. We're looking at some other options and some other pieces that might be available in the future for members outside the U.S., but right now it's only available for members in the U.S. And probably should have started with this, it's free. There is no cost for members to utilize this program, just like with all of our Teladoc services. It is offered free of charge, not subject to the calendar deductible, no co-insurance or copay per utilization, free to members. We want you to get the care that's available to you in the way that it's easiest. So as Lisa said before, this is care that's meeting you where you are. So please take advantage of it. Now, Lisa, I have been excited. I've tried to hold back a little bit as we've been talking, but like I said, this is almost 2 years in the making for our members, for me to get this out there. So I likely have missed something else. What did we not cover, or what would you add?
Just a couple last things. I'm really, to the point of in the United States and free. It's for members 18 years or older, so that's important to note. And I'm really, really proud that our product has delivered with a success and satisfaction of 98% from the members. So that's really makes me happy. Members are really loving this. They're feeling comfortable. They're feeling that it's convenient, it's saving time. And we really just have to get the word out so folks know that they have the service.
Absolutely. And we'll be working on getting that word out further. We'll hopefully have some additional opportunities in the future for members to learn about that. But for now, Lisa, thank you so much for sharing your time with us, for sharing your expertise and your enthusiasm for this program. I am so excited. I hope to see members starting to use this very soon and joining those 98% of members, users who are excited about this. And we'll talk again soon, I hope. Thank you, Lisa.
Thank you so much for having me. And Kyle, just one more comment.
Yeah.
If folks need the URL again, it's teladoc.com/Aetna, and it's 1-855-TELADOC or 835-2362. And it's been a pleasure joining you today.
Thanks, Lisa. And we'll make sure that information is also in the show notes so people can easily access it. Thank you.
Great.
Thanks again to Lisa DeLarso for joining us today. For more information about virtual primary care or other services offered in the United States from Teladoc in partnership with the Foreign Service Benefit Plan, please visit teladoc.com/Aetna or call 1-855-TELADOC, which is 835-2362. I encourage you to download the Teladoc app or visit that website today. Go ahead and register and complete the medical questionnaire so that you're ready to access care when you need it. Please see the show notes for additional details and links to this program. Please note that the virtual primary care program is available only to Foreign Service Benefit Plan members age 18 and older and physically located in the United States. Thanks for listening, and be sure to subscribe to AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share your feedback with us on Facebook, Instagram, or LinkedIn. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail.
Thanks for joining us this week on AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live on our YouTube channel at youtube.com/AFSPA Cares at 11 a.m. Eastern Time to answer your questions. Thanks for listening.